Vitamin D supplementation in pregnancy and lactation and infant growth.
Vitamin D for breastfed babies can help ensure healthy bone growth.
Vitamin D comes first from the sun, from foods, and from supplements. All breastfed babies in Canada need a vitamin D supplement because often a mother's breast milk doesn't contain enough vitamin D. And there are many months of the year where we don't get a lot of sun exposure. And it's important too that infants under the age of 6 months aren't exposed or aren't in direct sunlight, and not to use sunscreen until after 6 months of age. If breastfed babies don't receive a vitamin D supplement, there is concern that they will develop weakening bones, which may lead to rickets, or sometimes known as kind of a bowing of the legs. There are some babies in Canada who may have higher vitamin D needs, and it's best to speak to your doctor to find out exactly which population groups might be at higher risk for vitamin D deficiency or who may need a higher level supplement. Parents are recommended to give a supplement of 400 international units of vitamin D. Best to speak to your pharmacist. There are a number of different vitamin D supplements on the market to find out which one will work best for you and your infant. There's also different options in terms of how to administer or how to give the supplement, and there are different choices. You can ask for ones that have no taste as well. The recommendation is to continue with the vitamin D supplement until the infant or child is taking 2 cups of fluid milk and is eating a variety.
Vitamin D is a fat-soluble vitamin that is naturally present in very few foods, added to others, and available as a dietary supplement. It is also produced endogenously when ultraviolet rays from sunlight strike the skin and trigger vitamin D.
The nutrition industry and by non-medical personnel. There's been some recent studies that suggest that vitamin D might lower blood pressure, but these studies are not of the highest quality. There's also controversy because national authorities are not certain what level of vitamin D actually is a normal level and what constitutes a low level. Our advice is not to start vitamin D as a means to lower blood pressure. There's really not enough evidence to suggest that that's a beneficial approach. Again, caution is indicated. Not taking vitamin D unless there's a very clear indication is probably the right policy, with one exception. Calcium and vitamin D in women, particularly women at risk for osteoporosis, does have benefits. For the male gender, there's less evidence of benefit. There's uncertainty about what a normal level is. It's certainly not in prime time approach to lowering blood pressure and shouldn't be relied upon as a means to control blood pressure for those patients that have hypertension.
Vitamin D promotes calcium absorption in the gut and maintains adequate serum calcium and phosphate concentrations to enable normal mineralization of bone and to prevent hypocalcemic tetany. It is also needed for bone growth and bone remodeling by osteoblasts and osteoclasts.
Growing up, our parents told us to drink lots of milk to build strong bones. However, the amount of vitamin D in milk doesn't come close to what we may actually need. So says Dr. Joanne Manson, Chief of Preventive Medicine at Brigham and Women's Hospital.
It's very difficult from foods alone to have adequate intake of vitamin D. The main sources of vitamin D are sunlight, ultraviolet light exposure, which causes the skin to synthesize vitamin D, and getting dietary intake through supplements or the diet.
The necessary maintenance of skeletal mass is highly dependent upon vitamin D and calcium, and vitamin D is necessary for the intestinal absorption of calcium from the diet.
Osteoporosis Center for a study on vitamin D and bone health.
1 out of 2 women and 1 out of lifetime. And we found that 90% of patients admitted to Brigham and Women's Hospital had low level
It will be to determine how much vitamin D we need to prevent fracture.
Cognitive function, decreased depression.
However, Dr. Manson says much more research still needs
And minerals that
Vitamin D may influence fetal and postnatal growth through effects on calcium absorption, parathyroid hormone expression, phosphate metabolism, growth plate function, and regulation of the insulin-like growth factor X.
Ding.
In breastfeeding, vitamin D is needed to support healthy bone development and to prevent rickets, a condition that causes weak or deformed bones. Vitamin D deficiency rickets among breastfed infants is rare, but it can occur if an infant does not receive additional vitamin D from foods, a vitamin supplement, or adequate sunlight exposure.
Hello everyone, and welcome back to another episode of The Truth About Vitamin D with the Vitamin D Council. My name is Missy Sturgis, and today we are going to discuss a common misconception regarding vitamin D during pregnancy. So although breast milk contains an abundance of nutrients that are required for proper growth and development of the infant, it's often lacking in one important nutrient, and that is vitamin D. There's a couple reasons for this, but it's mostly revolving around sun avoidance habits and lack of supplementation. So the average prenatal vitamin only contains a few hundred IU of vitamin D, and that's really not enough to get the average adult to reach vitamin D sufficiency, let alone a mother and her infant. So there was a study in 2015 conducted by Dr. Hollis and his team that found that pregnant women actually require a little more vitamin D than the average adult to reach vitamin D sufficiency and also supply her baby with enough vitamin D through her breast milk. And that's about 6,400 IU that's required per day, a far cry from that 300 or 500 IU that's commonly found in those prenatal supplements. And with health conditions such as autism, developmental delays, behavioral issues, low birth weight that are all associated with vitamin D deficiency, it's really important to act early on this. I hope you enjoyed this video, and we will see you next week.
Conclusion: prenatal or postpartum maternal vitamin D supplementation has no significant effect on infant length or other anthropometric outcomes by 1 year of age. The lack of effect of prenatal vitamin D on length was evident from birth and was supported by sensitivity and stratified analysis.